I'm Dr. Shawn, an academic in the Alice Lee Center for Nursing Studies. I'm a registered nurse and a registered mental health nurse with the Singapore Nursing Board. Having a sustainable research plan is important for an academic to pursue, as the intention is to develop and have a sustainable program that can eventually benefit the population in the country that you are in. Therefore, I'm very pleased to share my research that focuses on mental health and mental well-being of the people in Singapore. The program is Mental Health Reintegration in the Community, the Legacy Program. Mental illness is characterized by alterations in mental state where an individual's thinking, mood, or behavior is affected by the distress or its impact functioning. Mental health issues are starting to gain its recognition as an important indicator for good health in the community. In Singapore, according to the recent Singapore Mental Health Study in 2016, there were about 14% of the people in Singapore have had experienced mood, anxiety, or alcohol use disorder in their lifetime, with major depressive disorder increasing to 6.3% of the population and a significant treatment delay of 11 years for people with obsessive-compulsive disorders. The Legacy program is based on my clinical specialty as a mental health nurse, focusing on two specific areas. One, community engagement, which promotes good mental well-being among the people in the community. And two, community reintegration, which promotes positive experience among people with mental health needs during community reintegration. I will be using different research approaches to explore the mentioned phenomena. In community engagement, individuals with positive mental well-being are more likely to reap the numerous benefits to their own life, such as the reduction in stressful situation, the decreased risk for disease and injury, better coping, and improve the overall quality of life. In this domain, I've received a donation from the Community Foundation of Singapore to embark on a study to lead a team that explore the use of therapeutic rainforests as an intervention. At the start of the project, I conducted a systematic review and meta-analysis on the psychological effects of therapeutic rainforest bathing. The systematic review manuscript is currently being peer-reviewed, and I hope that this paper will contribute to the further understanding on this topic. Finally, my team is currently conducting a randomized control trial on the use of therapeutic rainforests in reducing stress and anxiety among undergraduate students in the National University of Singapore. The trial has recruited 67 participants, and they are being randomly allocated to 3 arms designed for the study. Our team will be conducting this study across a period of 8 weeks, and we hope that with the results obtained from the study, we will be more prepared to run this in a longitudinal manner. In community reintegration, I'm looking at how to promote a positive experience among people with mental health conditions when they reintegrate with the community. In this domain, I have several projects that are linked together. First, a series of work was done to explore the perception of mental health recovery among different groups of pre-registered healthcare professionals. I have since completed the exploration with nursing and medical students. I'm now exploring the phenomena among psychology, social work, and occupational therapy students. Having an understanding on the perception of mental health recovery among the students is important, as they will be the future generation leading the healthcare industry, taking care of the patients. We can tailor our curriculum and ensure that students are better prepared to embrace consumer-driven healthcare, especially in the mental health arena. Second, I had completed a systematic review that explored the effects of online stigma reduction programs when compared to face-to-face programs. The review showed positive results on the use of online programs in reducing stigma. This review was timely as COVID-19 pandemic has created a situation where face-to-face program may not be possible most times due to the safe distancing measures implemented to deal with the pandemic. Third, I'm in the midst of conducting 2 qualitative studies exploring the perceptions of community interventions for both the people with severe mental illness and their caregivers. Results from these studies will give a better understanding on the needs of both the patients and their caregivers. I will then implement an integrated interventional community program that cater to the needs of the people with severe mental illness. Finally, I've completed a qualitative study exploring the experiences of community mental health workers when providing care in the community. Results from this study illustrated the different needs of the community mental health workers as they toggle their care delivery duties with the patients in the community while receiving feedbacks and support from the care team in the tertiary hospital. This is an important area as teamwork is crucial if we want to ensure quality care for our patients when they reintegrate in the community. By improving the work experience of community mental health workers, this will help to ensure the delivery of seamless care to patients when they reintegrate in the community.